On Thursday, February 13th, the Greater Muhlenberg Chamber of Commerce gathered for their monthly luncheon. The main speaker at this event was Steve Meredith, interim CEO of Muhlenberg Community Hospital. Meredith passed on a considerable amount of information regarding the future of our local hospital.
We get to a couple of things today. I want to thank, for all of us, to thank our meal sponsors, Muhlenberg Community Hospital, and Gene Catering for providing the meal today. Today, we're going to hear, as it's titled, some information about the future of Muhlenberg Community Hospital. So we have with us today Steve Meredith. He's the interim CEO of Muhlenberg Community Hospital and has been since October.
Well, thank you for letting me be your speaker today, but more importantly, thank you for the hospitality that you folks have shown me over the past few weeks. Quite truthfully, I'm the most ignorant person in the organization. Most hospital CEOs are because we're generalists. We don't know the jobs of nurses and doctors or housekeepers. We have to rely on them to do their job. And if they're waiting for administration to make a decision about what we need to do, we could be waiting a long time. So what we're trying to empower our people to do is accept total responsibility for your job. From day one, decisions that you can make about your job, make those decisions. Don't wait for administration. The third thing we're focusing on is communication. So our commitment is we're going to have open and honest and two-way communication with each other. Very simply, if I have meetings with our employees and I tell them something, if they don't understand it, I don't expect them to leave that area and say, what was he talking about? You ask me, then you ask me. In the spirit of communication today, I want to be brutally honest with you about your hospital, our hospital. It's in bad shape. We're struggling. 2012, we lost, I think it was $1.7 million. And that's cause for an alarm right there. In 2013, we lost $2.4 million. If you do the math very quickly, over a 2-year period, we lost $4.1 million. First, there's three things that have really impacted us. One being patient volume. It drives any business. The more business you have, the more successful you're going to be. You folks are well aware of what's going on within this community. With our primary care physicians, our family practice internal medicine, over the last 2 years, we have lost over 50% of our primary care physicians to a competitor hospital. We've lost a third of our general surgery coverage, and we totally lost our OB department. Secondly, the economy has not been a friend to us. I heard just a couple of weeks ago that we're in the 56th month of economic recovery, but I'm afraid nobody has told Muhlenberg or Grayson County, where I live, because we still see double-digit unemployment. I don't know when the recovery is supposed to hit us, but it's not here yet. So that's caused us to have tremendous bad debts in charity over the last couple of years. We're talking hundreds of thousands. The third thing that's impacted us, and I want to do a disclosure here. So I gave this address to another group the other day and didn't fully understand what I was trying to say. In the interest of open, honest communication, full disclosure, I am a Republican. But what I'm going to share with you has nothing to do with my political leanings. It's my opinion based on 40 years in this business. The third thing that has dramatically impacted us is impacting every hospital in this country right now is the Accountable Care Act, or Obamacare, however you want to refer to it. I think I like Obamacare because even the Accountable or Affordable Care Act, I'm having a hard time wrapping my arms around that, because what are we trying to accomplish with this legislation? Well, some folks will say we have to make health care more affordable. Yeah. Other people say we have to make sure everybody has insurance coverage. Okay, but the two are not compatible. You can't add 50 million people to a healthcare delivery system and expect you're going to reduce the cost. What are we trying to accomplish by this? It reminds me of a story about a father who goes to his daughter's house one evening, and when he walks in the door, he sees his son-in-law packing his bags. He's angry, he's mad. He says, what's the problem? So I'll tell you the problem. I came home from a business trip one day early. I texted your daughter that I was coming in a day early, and when I get here, I find her in the arms of another man. He said, whoa, there's got to be some reasonable explanation to this. There's got to be something. Just settle down, let me go talk to her. So he leaves, comes back to the room, tells his son, you weren't for nothing. I told you there was a reasonable explanation for this. She never got your text. The problem is not 50 million people who don't have health care. The problem is the government's involvement in health care. If the goal is to add $55 million to the healthcare delivery system, how are we going to pay for that? Well, part of the President's plan, and what has hurt us, is that the American Hospital Association, on behalf of all the hospitals, agreed to give up $550 billion in Medicare. When it's ratcheted down as what it means to this hospital, it's over $1 million a year. Now, the rationale is being that now everybody's going to have coverage, so you're going to make it up. It doesn't fit together that way. Medicaire's own actuaries say that even when this thing is fully implemented, we're going to have 30 million people who still do not have insurance coverage, in part because they choose not to, and because a good percentage of our population is for the illegals that are here. So when it all boils down to it, we may be adding 10, 11 million to the healthcare delivery system, but we're still leaving out 40 million. So we're doing all of this for 11 million, turning the whole healthcare delivery system inside out. It just doesn't make sense. On top of that, we've also had to deal with sequestering, another 2% reduction in Medicare payments. And also there's some special provisions for rural hospitals that recognize we serve a disproportionate share of Medicare and Medicaid patients. Medicare at present, on the average, every hospital loses 6 cents on the dollar for Medicare patients. Now on the Medicaid program, it's about 3 times that much. For Medicare and Medicaid, that's about 75% of our payers that we lose money on. Where do we make it up? And one of the major reasons that your insurance premiums are high as they are is because the government will not pay the full cost of providing care to Medicare and Medicaid. The other thing that's hit us that we didn't anticipate was Medicaid cuts in this state. The government decided he had to cut $385 million from the Medicaid budget, so cut payments too. For example, Medicare decided a couple years ago that they were no longer going to pay for CT scans of Medicare patients who come to the ER, head scans, unless it was trauma related. Well, what's wrong with that? If our parents, grandparents go to the ER with a headache, you hope it's just a headache. You know, if they're saying it's got to be trauma related, meaning they either fell down or they were in a car wreck or something like that, then they'll pay for it. The problem is, that simple headache could be a cerebral aneurysm. The Obamacare side of it, the Medicaid cuts by themselves are enough to put every hospital in crisis, and they are. Personally, I don't know of a single hospital in the state that's making money. Saying that rural communities, such as ours, is in danger of becoming irrelevant. That's such a strong statement to make. But the more I see the administration's policies unfold, the more I'm convinced there is an agenda there. Medicare's own actuaries have suggested that short of legislative intervention, by the year 2025, as many as 30% of hospitals in the United States will close. The future looks very dark, not only for this hospital, but what we're going to do going forward. Let me tell you, Dave, I am strongly convinced, have great personal assurances that Muhlenberg Community Hospital will be one of the survivors. It will not be easy. Over the next 3 to 5 years, it's going to be a critical time for every hospital to justify their existence and to find out how to survive in this new system. But we can survive. This is your hospital. You're as responsible for it as our board of directors, these people over here. It's your hospital. It's yours to lose. But I'm confident you will. Because again, it's a great community. You folks got so much going for you. I can feel the energy here. Every time I've come to one of these chamber events, I feel the energy. You folks are doing some great things, but don't ignore your hospital. You can't afford to. That in any time you have a question about what's going on within our organization, you call us and ask us. That's part of the commitment to open, honest, interactive communication. And if we work together, you believe in us, you support us, we will not just survive, we will thrive. Don't mean to scare anybody. It's just tough times for hospitals. This will include it.